Let's start off with the basics. What exactly is periodontitis, and why should people care about their gum and oral health?
So periodontitis is a type of gum disease. It's quite a common type of gum disease that affects the tissues supporting the teeth. So it's not a disease of the tooth as such, but it's a disease of the gums and of the bone around the teeth. And the main problem with this disease is that it causes tooth loss, because the bone and the gums recede around the teeth, and eventually the tooth loses support, becomes wobbly, and falls out. And this is a result of inflammation. So it's due to bugs, to bacteria that sit between gums and teeth, and they trigger this inflammation that eventually results in the resorption of the bone and the gum. And obviously this has some major repercussions for patients when they end up losing teeth.
So, for simple sort of terminology, what is inflammation? What are specific stressors that can drive inflammation or increase inflammation, specifically within the gums?
So inflammation is a reaction of the body against some insults, which might be bacteria, it might be a result of trauma potentially, or it might be viruses. So it's a way the body has to fight against infection, essentially. So it's a protective way, it's a protective mechanism, but at the same time, it can also have some detrimental effects.
So, is periodontitis a form of chronic inflammation rather than acute inflammation? That's correct, right?
Yeah, it
And
is.
are there specific patient populations or demographics who may have a higher chance of having periodontitis? Like, as a 25-year-old, should I be worried? Or, is it just older people? What's going on there?
So periodontitis is very common, as I said, and probably around 50% of the population will get some forms of periodontitis. As a 25-year-old, you probably shouldn't be too worried at this stage, but this is maybe the stage where you can put things in place to avoid having periodontitis later in life, because it seems like periodontitis incidence peaks in the late 30s, and then it becomes more evident for most people when they're in their 40s or 50s. But it's, as you said, it's a chronic disease. So it builds up with time, and often people don't realize when it starts because it doesn't really give any pain. And then the first symptoms you start having is when the gums bleed, or when the teeth become wobbly, or they start drifting. And prevention is important. And obviously oral hygiene is key. Brushing your teeth well, brushing in between the teeth, and also seeing the dentist regularly to have your teeth cleaned. Because a lot of the reasons why people get periodontitis is a buildup of plaque, but it's not just that, because there are some people that are highly predisposed genetically who actually get very advanced forms of periodontitis as teenagers. So that also happens, but it's more rare. More often than not, it's the buildup of plaque over the years that eventually leads to periodontitis later in life.
And so, with your study, tell me about your findings. What exactly did you find out when you implemented a fasting-mimicking diet for your participants?
So we can say that this was the first time that this diet was used in patients with gum disease. And the idea was to see if the diet was feasible. So this was a feasibility study. So can we actually give this diet to patients while they are having their treatment for gum disease? So the standard treatment for gum disease is a professional clean of the teeth above and below the gum line. So this is what we would normally do. So our idea was, can we actually also give the diet at the same time as patients are having the treatment, with the idea that the diet would possibly reduce the systemic impact of inflammation in these patients? Because we know that, again, as we mentioned before, patients with gum disease have inflammation not just in their mouth, but it spills over in the rest of the body. And when they have treatment, they seem to have initially an increased inflammatory response as a result of the treatment, and then in the long run they have a reduction in inflammation. So this is what we wanted to test, and this is the first study that was done with this particular application. So one of the things we wanted to test was feasibility. Can patients actually take the diet in a relatively stressful time when they're having this gum treatment, which can be quite sensitive and uncomfortable. And then we wanted to see if there was an effect on systemic inflammation. So in a nutshell, what we found is, first of all, that the diet was feasible. So the patients who were given the diet reported taking the diet and not eating anything else. So they managed to just have the diet for those 5 days, for just a one cycle. And the second thing we found is there seemed to be some effect in patients that were on the diet in terms of reduction in systemic inflammation measured as CRP levels. However, this was just a feasibility pilot study. We only had 20 patients. They all received periodontal treatment, and 10 of them were on this specific diet, while the other 10 continued their normal diet. So it was a first attempt. It was quite interesting, but obviously we don't have any definitive results. We have already carried out another study following from this, which we haven't published yet, where we've then moved this on to the next step. So having proven that one cycle is feasible, it seems like we have very interesting results from this other study, but as I said, this is soon to be published, hopefully.
So let's talk about sort of the clinical outcomes or the clinical measurements that you took. And so you mentioned CRP. Just for our listeners, what exactly is CRP and its link to inflammation, but also specifically the mouth?
So C-reactive protein is a protein that is produced by the liver as a response to an inflammatory insult. The reason why we measure it, it's because it is a prognostic factor for a series of cardiovascular events. So the higher is the C-reactive protein, the higher there's a risk that something will happen to the body. So it's like an alarm bell. If you have high levels of CRP, then that means that something is not right with the body. There are some areas somewhere in the body, it's non-specific as to where the insult is coming from, but it's a signal that there is a high alert because of inflammation. And that's why it's measured in many diseases that have some inflammatory implications. And that's why we measure it for periodontal disease. It's not very specific, as I said, but it's a clinically relevant measure. And that's why we've considered that the main outcome of the study.
So you mentioned heart disease, and I think we know that C-reactive protein is a biomarker when it comes to cardiovascular health. Is there any sort of correlation between periodontal disease and heart disease within the clinical population? Is it just the link of they're both sort of inflammatory related on that sort of level, if that makes sense?
Yeah, so there is certainly a link. Patients with periodontal disease have a higher risk of having cardiovascular events. And this has been clearly proven in multiple studies. Actually, the other thing that we know is that patients that have periodontal disease, compared with patients without periodontal disease, tend to have a shorter lifespan because of the associations between periodontal disease and a series of systemic conditions, not just heart disease, but diabetes, certain types of cancer. So this is proven. What we don't know for sure is the sequence of events. So we don't know whether having periodontal disease predisposes to these other conditions or not. Or whether it's just shared risk factors, shared genetic factors, shared maybe inflammatory factors, and so on. This is not very clearly established, but there is no doubt that patients with periodontal disease tend to have a higher risk of a series of conditions, including heart disease.
I should look after my oral health a bit more better then.
Definitely.
So back to the sequence of events, I think this is potentially something really interesting just to talk about and think about, is the fact that we don't know if it's correlative. So because you have high amounts of inflammation in your mouth, that means you're going to have a high amount of systemic inflammation. Or do you think maybe if we're hypothesizing that you can start with periodontitis because of the lack of, oral health and whatnot, which can then spread and lead to other sort of systemic inflammatory diseases, such as, heart disease or whatnot. What's your take on that sort of hypothesis or that assumption?
It is plausible that periodontal disease will predispose to these other conditions, but it is very difficult to prove it, because to prove it, you'll have to do a study where you take patients with gum disease and you treat some of them and you don't treat some others, and then you follow them up over 10, 20 years, and you see if there is a different effect of having treated periodontal disease on the risk of developing other diseases. So I'm afraid it's something we will never really be able to prove for sure. We also know that there are some shared factors. So there's no doubt that, for example, people who smoke will have a higher risk of having gum disease as well as heart disease. Also, there is the effect of having diabetes, for example, predisposes to gum disease, and it also predisposes to heart disease. So there are a lot of shared risk factors. So it's very difficult to disentangle the effect of the single shared factors and from the potential causative effect of gum disease on systemic health. And researchers around the world have been trying to answer this question for the last 20, 30 years, and it's been very difficult to actually know for sure. But there's no doubt that having gum disease means you need to have it treated anyway, because that stops you from losing teeth and it reduces the systemic burden of inflammation. So chances are, if you have gum disease and you treat it, or if you prevent it in the first place, you will have a reduced burden, so potentially a reduced risk of having all these other conditions. And this really started in the late 80s when we found out that there was an association with heart disease, and there's been a flood of research and papers, and almost every day we find out something new. And the newer thing over the last 5-10 years is the association with certain types of cancer, which has been somewhat surprising, and it's really quite interesting as well, how potentially certain bugs coming from the mouth may be the trigger of some types of cancer.
I don't know if we're deviating, but purely because I was next to Julian Naglick's group when I was in my master's. Would you think the oral microbiome also has a significant sort of contributing factor to all of this? What's your take on that? It's a bit of a deviant question, but it just popped up. So
yeah, absolutely. It is all to do with your microbiome, either directly because the bugs are traveling in the bloodstream and they can reach different places, or because of the inflammation and the oxidative stress that may be a result of having this high amount of bacteria in the mouth. So it is really all to do with the bugs.
So if we go back to your study, you mentioned it was a feasibility study. It was safe. There was no people adhered to the fasting-mimicking diet, if that's correct.
Yep.
And you also saw a blunt in inflammation in sort of cytokine markers and whatnot. What do you think the potential mechanism behind that is? Are we just talking about an inflammatory effect? Are we talking about effects on autophagy, on ketone bodies? What's your hypothesis with regards to the potential mechanism driving this sort of clinical phenotype?
So we are still currently studying the potential mechanisms, because we took samples from patients, and we also, as I mentioned before, we carried out another follow-up study on more cycles, more patients, and again we have samples. So this is something that probably I'll be able to answer better maybe in 6 or 12 months from now. At the moment, it's hypothesis that it's also based on other studies done using this diet on different settings and different types of populations. But probably there is an inflammatory effect, because we know that certain diets, especially the ones that are rich in refined carbohydrates, actually cause more inflammation. So we suspect that the reduction in carbohydrates and this more plant-based diet probably would result in a reduction of inflammation, because the key thing is inflammation is needed. It's important. We would die if we didn't have an inflammatory response. It's a way the body has to fight bacteria. So it is very important, but sometimes it becomes dysregulated and the body just in a way overreacts. It creates too much inflammation, and that ends up being damaging rather than protective.
Yeah.
So we don't want to avoid inflammation altogether, but we want to reduce it and regulate it more. So trying to find ways to regulate and reduce this inflammation is what we're trying to do with gum disease. And there are different strategies. And what took us to study this particular approach is that we saw some other studies in different diseases, but where it seems like regulating the diet can also regulate the inflammatory response. So we thought, well, what better way, rather than loading the patients with lots of medications that may have an effect of inflammation, but potentially can have other side effects. Maybe a more natural way would be the way forward, where you reduce inflammation by just controlling your diet.
I think you touch upon something very important, which I don't think we really think about in the modern world, and that is that sort of how much our diets can really have an impact, not only on our oral health, but our physical health, our mental health, our metabolic health. And you touched upon something really important, which was carbohydrates. And so if let's have a thought experiment. If we were to repeat your fasting mimicking diet experiment on participants, but those calories were not filled with, unsaturated fats or veg and all the good stuff, but more with refined carbohydrates, do you think we would see the same sort of benefits that we would have seen? Or do you think also the component of the diet is also just as important as restricting your calories or fasting or whatnot?
Yeah, that's a very interesting question, and maybe that could be the next study we do. We will restrict the calories, but then have different sources of calories. I would think that obviously it's not just about reducing the calories, but it's also the type of food, and carbs versus lipids or proteins probably make a big difference. I don't really have a clear answer for this because it's not something we tested, but I suspect it's not just the quantity, but the quality as well that makes a difference.
Yeah, I think I'm not an expert in this field, but I believe that there are certain foods that would trigger a higher inflammatory response compared to other foods, right? And so that's something that we may need to account for in our day-to-day health. But then do you think that should also play a part in patients who do have periodontitis? And so what I guess I'm trying to get across is, yes, you need to have a good diet, whatnot, before and prevent periodontitis. But if you are someone who has periodontitis, should you be looking at your diet, how you eat? I completely understand that your study is still in early days, but we're just really looking at that sort of connection between oral health and diet in a very sort of holistic manner, in that sort of sense.
Yeah, to answer that, I would say that maybe say 20 years ago, when I would have a patient with gum disease, and I would explain to them, you have gum disease and so on, and explain what we could do to treat it. Occasionally, I would have patients that would ask, shall I change my diet?
Yep.
Simply because maybe they heard about the risk of cavities on the teeth when they have sugary food. So they would think, oh, maybe there's something specific that I should or I shouldn't eat for gum disease. 20 years ago, my answer was no. I don't think there's any relation between diet and gum disease, so I can't really advise you on changing your diet. My approach now is different. Of course, I'm not a dietitian and I cannot give specific advice, but there are certain things that we know now. We know that gum disease seems to be worse in people that are overweight or obese, for example. So there is probably an effect on excessive caloric intake and risk of gum disease. And we know about the refined carbohydrates and their relationship with inflammation. And we also know about the vitamin levels in gum disease. So I normally give a very basic advice, and I would normally direct patients to see a nutritionist to try and have a healthier diet, especially if they are overweight or if they have diabetes or prediabetes. As I said, I'm not really equipped to give specific information, but my advice normally would be to try and have a complete diet, including fruit and veg, having enough vitamins, and at the same time trying to avoid excessive sugars. That's definitely something I would advise patients, the refined carbs. We have another study that we've done also with Giuseppe, and it's in press at the moment, where we've looked at dietary habits of patients with and without gum disease. And we've seen that there are certain associations between, for example, Mediterranean diet seems to be protective towards gum disease, whilst a diet that maybe has more red meat or more carbohydrates in general seems to be less protective and more associated with gum disease. There's a few studies on these that have been published recently. So there does seem to be something there. So again, 20 years ago, I would have said, no, there's no association. Don't worry, don't change your diet. Now I say probably there is an association, and I gave a little bit of advice. I suspect that maybe in 10 or 20 years, we will be able to give more specific advice. And in the era of personalized medicine, we may be able to give very targeted advice to specific patients, because there could be some people where the effect of diet may have more profound impact on periodontal disease than others. So maybe we will be able to study in more detail diet and micronutrients as well, and be able to advise patients on what they should be eating if they are at higher risk of gum disease or other diseases.
Yeah, I think the touch upon personalized sort of medicine is very interesting. I had a similar conversation with Professor Bryant about this with regards to intermittent fasting, because there are different intermittent fasting protocols that one could take. And, I asked her the question, I'll ask you the question as well, because, and I think it would be very difficult to answer, but I think it would be very interesting just to think about. Do you think that based on a patient's, let's say, genomic background, that they may be different responders to different diets in that sort of sense? The reason I say that is because outside of the fasting world, I think there are people who, this is purely anecdotal sort of evidence, but I think there are people who thrive really well on a vegan diet. There's certain people who will thrive really well on a vegan diet, but someone else may not be able to thrive that well on a vegan diet. Me, I thrive really well when I fast during the day, but my mum wouldn't be able to survive it. And so if we were to think about it, maybe there is sort of a genomic sort of difference between participants, which sort of drives this potential difference. And so do you think different patients might be different responders to diet, which then would then have a knock-on effect on, say, their treatment?
I agree completely that that's the case. But of course, it's all about researching more into it and understanding it. Yeah, definitely that the effect of a diet in one person will not be the same on another person, because of largely maybe some genetic variants, but also because maybe of the microbiota. We all have a selected specific gut microbiota, and potentially because of the core gut microbiota we have, we may be better or less suited to have a diet or another diet. So I think that is the future, personalized medicine, and that the same applies to gum disease, of course. But of course, before we can get to the stage where we can give specific individualized advice, we need to do a lot more research to understand all the nuances between the associations between genetics, bacteria, and the effect of things that can modify them.
There's obviously a ton of research on the gut microbiome and its relationships with regards to the gut-brain axis. There's also a bit of research on the lung-brain axis, which I've been interested in because I work on the lungs. What's the relationship potentially between the oral microbiome and our brain? And I'm not even talking about sort of from a disease perspective, but even with regards to mental clarity in that sort of sense. Like, do you think there's something there? I mean, there's a lot of talk about it on social media in the modern world, but I'm not sure. I haven't looked at the scientific evidence with regards to that sort of association.
Again, there is some evidence of association between gum disease and things like dementia. And there is a whole line of research that has developed in the last decade that looks at how does that happen. And it seems like there are some specific bacteria that are normally found in diseased gums that can, again, travel to the blood, potentially reach the blood-brain barrier, and potentially there are maybe some bacterial fragments or something that can then stimulate and increase the risk of having dementia or Alzheimer's disease or even Parkinson's. So again, there is some evidence. We cannot say it's very clearly established, but there is potential mechanism mediated by this specific bacteria. So some of these bacteria, there are some very interesting bacteria. One of them is called Porphyromonas gingivalis. Another one is called Fusobacterium nucleatum. They are found in relatively small amounts in the gums, but they seem to be able to have a very strong effect in influencing gum disease. That's why they are called keystone pathogens. So even if they are in small amounts, what they do is they start creating havoc in the biofilm that is in the gum. So they can cause other bacteria to start misbehaving, or they can change the composition of the biofilm. But also, they seem to be associated with things like Alzheimer's disease or colorectal cancer. So it seems like when they travel to other parts of the body, they start upsetting the immune response, the inflammatory response, and they can potentially cause other diseases that until a few years ago we had no idea could be connected with gum disease. So it's very, very fascinating. And we are obviously working on this area, and we're not the only ones. There's a lot of periodontal researchers around the world that are trying to understand a bit more about this, but how some specific bacteria from the mouth could potentially be responsible for worsening the risk of having all these kind of diseases is very interesting, and obviously points towards the importance of maintaining good oral health.
Yeah, I go to my dentist. She tells me to brush my teeth, obviously, and do all of that. But I think after this conversation, I'm definitely going to put a bit more care into my oral health.
Yeah.
What are the early warning signs of gum disease that anyone should be looking out for? Is there something you should do before you brush your teeth? You should just have a look, or because when I brush my teeth, I go in, I just brush my teeth. That's it. I might floss. I don't look for warning signs. Should we be looking for warning signs?
Yeah, the first warning sign is bleeding on brushing. Your gums should not bleed when you brush them. If they bleed, it's because they're inflamed. If they are inflamed, it's because you probably have either gingivitis, which is the first step of gum disease, or it could be periodontitis, which is the more advanced form of gum disease. And sometimes I see patients that say, well, yeah, my gums bleed, but they've always bled. So, I'm not too worried about it. They've been bleeding since I was a teenager. And I thought it's quite normal that the gums bleed. I do get that sometimes. And I understand if patients have had bleeding all their life, maybe they think it's okay. There's nothing wrong with that. It could be that the gums bleed, but actually it's a bad sign. The gums should not bleed. They only bleed if they're inflamed. So that is the first warning sign. And if you neglect it, then there is a risk that things will get worse. And I often have patients that instead come and say, well, suddenly I felt that the tooth has become wobbly, or my front teeth have started drifting apart. And that is when the teeth become so weak because the bone is lost around them that literally they start drifting apart or they start becoming wobbly. In the worst case scenario, I have some people that just present for the first time with all of the teeth very, very wobbly because they started having wobbly teeth, but because it's a gradual thing, they sort of adapt. They stop eating certain things. They don't bite into food. They start covering their mouth when they smile because it doesn't look good. And some patients are a bit reluctant to seek dental help necessarily, so they actually present when they have very, very advanced gum disease. And often those are the cases where they already have some other comorbidities. They'll have prediabetes, or they have diabetes, or they've had a stroke or something like this. So hopefully we will reduce the number of people that get to that stage, but it's all about awareness. And we sometimes, in the press, there's these big things about floss or you're going to die of a heart attack. It's not obviously quite so direct that if you don't floss, you're going to die of a heart attack. And as I said, this is the evidence. We're still gathering the evidence as to a potential effect. But even if we look at gum disease on its own, forgetting about the association with the rest of the systemic health, even then, if it leads to losing teeth is a very, very invalidating thing that you don't really want to get to. So it's very important, even to treat gum disease in its own right, it's very important because it will lead to a better quality of life. And the more you prevent, I mean, it is really all about prevention. The better you brush your teeth, the more regularly you go to see your dentist. And if you can clean in between your teeth, that's a key thing. It's not just about brushing, but cleaning in between the teeth, because often it's the plaque that gets stuck between the teeth that then leads to gum disease.
So, aside from wanting to go to your dentist, what other things could one do to reduce inflammation? I mean, I think cutting out sugar, obviously, is clear. What about sort of hydration, avoidance? I mean, does caffeine play a part? Are we talking about alcohol? I mean, I presume alcohol has a sort of bad rap for it. Are there any other sort of lifestyle choices one could make to prevent inflammation within the gums and therefore prevent the onset of gum disease or periodontitis?
Yeah, we don't. I mean, there are, again, recently there have been some papers published suggesting that a moderate amount of caffeine can actually help reduce inflammation and potentially help with gum disease. But I think there's definitely no conclusive evidence on that. Again, small amount of wine may be helpful, protective, but obviously not larger amounts.
Antioxidants, isn't it?
Yeah, exactly. It's the
yeah.
antioxidants. So it's hard to tell, and it's hard to give general advice. I would say definitely a reduction in sugars, a healthy diet, lots of vitamins, that's helpful. And I would definitely associate with that exercise. I think exercise is very important because, again, it reduces the accumulation of fat in the body, and fat can be a big producer of inflammatory cytokines, inflammatory proteins. So maintaining a low level of body fat, I think, is very important. And obviously you obtain that by combination between a healthy diet and regular exercise. So that's definitely something I would advise as a general rule, but it's difficult to be more specific.
So actually, and I don't know if it's a random question, but it's popped up because you mentioned exercise. I had Dr. Hurd on the show from UCL, and she works on the impacts of physical activity on depression. And she was actually talking to me about how there could be a potential link between inflammation and depression as well, and how physical activity can have a positive effect on inflammation and therefore depression, as well as any other sort of neurochemical pathways. Do you think, again, this would be it's a very difficult question because there's so many variables involved, but do you think there could be a link between mental health and oral inflammation, the oral microbiome, just as a thought experiment?
Yes, I think so. And it is actually something we are studying now. We know that mental health, again, and oral health can be related. And there is some evidence to suggest that having a poor oral health has an effect on mental health. Because, again, people that, for example, have very advanced gum disease, they start losing teeth, they also have bad breath. The appearance of the teeth becomes problematic, so they become self-conscious, so they become less prone to meet new people and to go out with friends and so on. So there's more tendency to isolation in those cases, and that obviously affects mental health. It's, again, factors that influence each other. So it's difficult to tell the direction exactly, but things like, again, exercise can help because it may reduce inflammation, it may help with mental health, it may potentially help with oral health as well. So there are definitely some connections there, in addition to the potential connection of what we mentioned before about the inflammation of bacteria traveling and potentially affecting other parts of the body.
Yeah. What's the one message you'd want everyone to understand about inflammation and oral health? Yeah. What would you want our listeners to take away from this specifically?
I would say that controlling inflammation in the body is very important because inflammation can lead to a cascade of events that then can lead to almost irreparable damage and potentially life-threatening diseases. So I would say that controlling inflammation in the body is very important. One of the common sources, one of the most common diseases in humans is gum disease, and it is a source of inflammation. So we often say if you had bleeding coming from your eye, or if you had an open wound in your hand that constantly bleeds, you would certainly be worried about it and you would do something about it. If you have bleeding gums, it's exactly the same thing. Bleeding gums are a sign that there is an uncontrolled inflammation in the body. And when people have tried to measure how much is the extent of the inflamed area in people that have generalized gum disease, they've calculated that the area is equivalent to the palm of the hand. So they say, just to give an idea to people, it's the same as if you had an open wound as big as the palm of your hand. You would want to do something about it because you wouldn't really want to walk around with a big open wound all the time. Open wound, it's just a way to, explain these in lay terms, if you like, but essentially it is an area where bacteria can go into your bloodstream where there is inflammation. So if you think you have gum disease, seek dental help. And if you can, prevent gum disease by cleaning your teeth well, controlling your diet, have good regular exercise, and go to see the dentist regularly. This would be my message, because it could be one source of inflammation, and it is one source that is relatively simple to control, if you like, compared with other maybe hidden sources of inflammation in the body that we may not be aware of.
Yeah, I think that's a really important point that I've never even thought about. It's an easy area to control your inflammation because you can brush your teeth, you can control your diet, you can control what you put in your mouth. Yeah,
and there's so much you can do by just brushing your teeth better, brushing properly. But of course, you need to be guided. And that's where the dentist, the hygienist, or qualified nurses can help explain how you're supposed to brush your teeth properly. What is the right way, what are the right instruments, and including things for brushing in between the teeth, like floss or interdental brushes, rather than just the standard brush. And then, of course, again, it also goes down to individual susceptibility. There are people that are more predisposed to gum disease, and they are the people that have to brush incredibly well. Otherwise, they will get gum disease. So depending on your susceptibility, you may need to do more of certain things like interdental brushing or water floss, water jet, and so on, whilst others maybe will be less at the risk of developing gum disease. But in general, everyone would benefit from brushing their teeth well and having less inflammation in the mouth.
Before we get on to the last question, you talked about susceptibility. Is that just because of poor lifestyle choices, or are there even genetic components which are sort of driving this potentially?
Yeah, there are genetic components. So we've done a very large study some years ago that's calculated that about a third of the reason why there is gum disease in the population is due to genetics. So you are sort of a third doomed to have gum disease, if you like, but it's only a third. The rest, the other 2/3, it's things that should be in your hands. You can control them. So for people who are very, very predisposed, they can put in place a series of things to reduce the effect of the predisposition. So yeah, there are ways to reduce the effect that susceptibility will give you to develop gum disease.
So how does one know if one could obviously get themselves sequenced. Is it purely just by looking at your parents? I mean, like, okay, you have gum disease, that means I might likely have gum disease. It's similar in the sense that when you go for your GP checkup, they say, has anyone in your family got high blood pressure or heart disease? Is that something dentists should be asking as well? So sort of familial history, has anyone got gum disease? That may increase your likelihood of gum disease. Therefore, you need to do X, Y, and Z to prevent the onset.
So there are claims to genetic tests that can tell you whether you are more or less predisposed to a series of diseases, including gum disease, but it's nothing quite definitive yet. And as you said, probably right now, the best way of telling if you're predisposed is to ask your parents or maybe grandparents if they had gum disease, because there is a familial aggregation. So generally, if you know if your parents had gum disease, then you know that you are at higher risk. The thing is that not everyone really is aware or has diagnosed gum disease. So we normally ask things like, do you know if your parents lost teeth at a young age? Do you know if they had wobbly teeth or if they have bleeding gums? And more often than not, young patients with gum disease have parents or at least grandparents who've had severe forms of gum disease. So that's probably the easiest way to know if you're predisposed.
Awesome. So let's just summarize sort of your main findings again from the recent study, which is that a fasting mimicking diet has the potential to blunt inflammation in patients with periodontitis, correct?
Yeah, exactly. So that's
yeah, sorry. What's next? Are we talking, a bigger time scale of fasting? I think the maximum that these guys fasted for was 3 months, if I'm correct. So we're talking longer time scales, bigger groups. What's next?
So the next study that we've already completed and analyzed, and as I said, it's not published yet, but
Okay.
it will be published very soon,
Yep.
has looked at 3 cycles rather than 1 cycle and a longer term follow-up, and is providing us with clearer answers. But then it's also extending this to other populations. Generally, just 1 study or 2 studies are not really able to give clear answers. We need to extend it to other populations, and we need to possibly target the more vulnerable, more at-risk groups of people like pre-diabetics or diabetics, where maybe the dietary intervention can have even a more profound effect. So I see this developing with time as maybe a potential adjunctive thing that we could use when we treat gum disease in certain populations. I don't think we're going to necessarily give this diet to everyone we treat that has gum disease, but maybe we can suggest it as an option to try and reduce inflammation alongside the standard periodontal treatment, rather than giving additional medications or antibiotics or other things that may have more side effects. And I think educating patients to diet is also very important. And we have actually seen in this study that there was a little bit of a tendency for the people who took the diet to then slightly modify their diet later on in a better way, in maybe having more hydration and more vitamin-rich food rather than excessive caloric intake. So it could also be a way to educate people beyond the effect of the single or the couple of cycles that we use.
It's great work. I'm a big fan of fasting. I think there's a lot of promise with regards to its effects, but I think better studies like yours are required. I think there's a lot of bad methodologies and bad evidence out there which people are sort of extrapolating a lot from, when really sort of very good rigorous studies are required for specific niches and for specific diseases. But anyway, I think that sort of association and that sort of understanding of how important your diet is and what you eat is really important to prevent these diseases, but also treat these diseases rather than always opting in for medication. And so I found it, a real joy. And I really liked reading your paper. So yeah, no, thank you so much. It's been a pleasure. I've learned a lot. I'm going to finish this conversation and brush my teeth. And
Definitely, yeah.
Thank you for coming on to the show.
Thank you very much for having us and giving us the opportunity to have a chat about this thing that you probably saw we feel very passionate about.
Yeah, I mean, I think as scientists, we love our research and we want to get it out to the world, not just through publishing papers, but, having that sort of impact. And I think that's why I started a podcast as well, is just to, spread the joy and the information to everyone out there and tell them that, we have good science going on. And, if you implement it into your life as well, it can have an impact on you positively. And I think that's the main message. But yeah, thank you for coming on.
Thank you.